for that. I am so excited that all of you are here to recognize this day for us in this special time for the state of Rhode Island. Today, we do recognize the official launch of the Rhode Island Pay for Success Permanent Supportive Housing Pilot Program, and as Susan has mentioned, a new initiative that intends to increase the number of Rhode Island residents who experience homelessness successfully maintain permanent housing. In October 2015, the United States Department of Housing and Urban Development, otherwise known as HUD, and the United States Department of Justice, or DOJ, formed an interagency collaboration to make $8,679,000 available to incentivize and support Pay for Success demonstration projects across the country. Now, the goal of the HUD and DOJ demonstration funding was to strengthen communities' ability to prevent and end homelessness and reduce avoidable incarceration by increasing the provision of permanent supportive housing, a proven evidence-based practice. So Pay for Success was also seen as a valuable opportunity to test ways of achieving greater cost-effectiveness in providing homelessness assistance while expanding communities' access to available funding for Pay for Success initiatives. In keeping with our mission of working collaboratively with stakeholders to create and advance lasting solutions to end homelessness, the Rhode Island Coalition to End Homelessness applied for and in 2016 was awarded a Pay for Success demonstration grant of $1.4 million to support planning and implementation to the Pay for Success Permanent Supportive Housing Program in Rhode Island. The coalition was one of just 7 Pay for Success demonstration grant awardees nationwide. Led by the Rhode Island Coalition to End Homelessness and the Rhode Island Executive Office of Health and Human Services, along with the funding from Make Home Capital and Rhode Island Foundation, evaluation from the Faulkner Consulting Group, and technical assistance from Social Finance, the Pay for Success pilot in Rhode Island is Rhode Island's first experience with social impact investing, an innovative model for financing social programs. The Pay for Success pilot explicitly seeks to house individuals who are high utilizers of healthcare, the justice system, and our homeless shelters with a goal of diminishing statewide costs and improving the lives of those with exceptionally complex needs. Rhode Island's Pay for Success pilot brings together, as Susan also mentioned, 4 local providers: Crossroads, the East Bay Community Action Program, House of Hope, and Open Doors, in addition to state government and philanthropic organizations to stabilize individuals currently using disproportionate amount of state resources such as Medicaid and corrections and other homeless facilities. Interested service providers across Rhode Island were selected through an RFP process during the fall of 2022. From that process, we selected the 4 aforementioned providers who will offer the support services through this pilot project. Service providers will receive advance payments throughout the life of Pay for Success to ensure that they are consistently resourced to carry out the work of the program. Their performance will be monitored based on the benchmarks and the robust evaluation. Pay for Success will also support approximately 125 individuals throughout this 5-year process. And as Susan had mentioned, we will engage the greater number of 200 or so in order to get 125. They will be found in maintaining housing and wraparound services in the state. Permanent supportive housing, as you know, is an evidence-based intervention that combines affordable housing assistance with voluntary supportive services to address the needs of chronically homeless individuals. So services including, for example, medical and behavioral healthcare job training, intensive case management throughout the years would be used. It is worth noting too that this is not a program where people can apply for services. Individuals will be assigned to service providers from an eligibility list. Permanent supportive housing has consistently been demonstrated to help people with multiple barriers to finding and maintaining stable housing. The permanent supportive housing is also the most cost-effective solution shown to lower public costs associated with the use of crisis services like our shelters, hospital ERs, and jails and prisons. Individuals enrolled in the program will volunteer to engage in the supportive services available to them through a program based on their own priorities and self-perceived needs. The Pay for Success service providers are expected to work diligently with each individual enrolled to build that foundation of trust that can encourage them to engage in services with the capacity to help them find and maintain that stable housing. So consistent with these requirements, the program's level of success will be measured according to the following outcomes: increased housing stability, decreased healthcare utilization, and/or decreased justice involvement among the program participants. And the pilot program will span 5 years, ending in 2027. A capital investment to begin the program goes to high-quality service providers, as we mentioned, and the program is evaluated by a third party, and if the metrics have been met, then state funds become available to repay the private investor. The FY22 state budget included $6 million provision to be spent repaying investors if and when the program meets these benchmarks as determined by the evaluator. So we know from 2020 to 2021, our state saw a 15% increase in the number of Rhode Islanders experiencing homelessness. So we're grateful that the Pay for Success pilot, coupled with a massive upcoming investment in affordable housing statewide, presents an unprecedented opportunity and a meaningful change for the Rhode Island's most vulnerable residents. So we're grateful that you have come here to hear us, to understand a little bit more about this wonderful, innovative program, and we hope that you continue to watch and support.